What's up, everybody? Dr. Tabor from A Better Way Chiropractic. In this video, I want to share exactly what is shockwave therapy. I want to talk about how it works, why it's so amazing, helps your body to heal, and we're going to go through that all step by step. There have been literally thousands of studies that suggest your body can actually heal and repair damaged tissue. Sometimes it just needs a little help. It just needs a little nudge. When we're talking about the shockwave therapy in this class, I'm going to be talking about focused shockwave. There's a different type of shockwave which is called radial shockwave as well. I won't go into that one as much. We use focused shockwave in our offices. I think both types of shockwaves are great. But with focused shockwave, we're getting focused energy. We're targeting the real source of the problem. We're promoting natural healing. And both types of shockwave are backed by just tons and tons of studies and science that shows it can help your body function the way it was designed to function, which is healing. And healing is how your body can overcome those injuries and all of that pain, right? So your body was designed to heal. It's just sometimes it gets stuck in this chronic cycle. There's inflammation, there's poor circulation, there's scar tissue, there's just this pain cycle, right? Neuroplasticity, they were stuck in a pain cycle. There's pressure or irritation on the tissues that are not allowing it to heal the way it was designed to heal. So if you're suffering from pain or injuries and you've been suffering for months and months or maybe even years, there's something going on that's keeping your body from getting that boost that it needs to overcome that injury and to heal that tissue. Yes, there's a limitation to matter. I get it. If you cut your arm off, I don't care what you do to your, the stub of the arm, it's not going to grow a new hand back, right? I get that. There's a limitation to matter. But your body is also amazing, and it can heal damaged tissue. It's just sometimes it gets stuck. There's interference that's keeping your body from healing the way it was designed to heal. Shockwave helps us to restart that healing process in your body. Shockwave literally speaks to the cells, but it's a mechanical language. In fact, we call this mechanical transduction. When healthy cells feel the right amount of mechanical force that they get from this shockwave therapy, they literally wake up. So shockwave delivers this mechanical stimulus to your cells, and that causes your cells to release these signals. The cell basically is sending messages to your body, restarting this healing process that needs to happen around the area. So it responds and the body activates that healing process again. It helps make the tissue stronger, or you have less pain, you start to function better, right? So the right stimulus, the right response equals the right healing. And this is literally the healing cascade that happens when you start getting shockwave therapy. It's a natural chain reaction that restores healthy tissue over time and over a series of visits. First of all, we get that mechanical stimulus, that shockwave, that focused shockwave that delivers that right mechanical energy to the tissues where it needs to be delivered. And then that initiates cell signaling. So those cells sense that stimulus from the shockwave and they send chemical messages out to the rest of your body, reactivating that healing process. Now, automatically, we get reduced inflammation. In fact, some studies show that even after one treatment of shockwave, you'll reduce or you'll increase blood flow by 39% and reduce inflammation in the area. Inflammation begins to calm down, creating the right environment again for your body to repair. Number 4, new blood vessels start to develop and grow. And this is where we get into what's called angiogenesis. We actually start to get healing and stem cell production and migration to the area. So those new capillaries grow. They bring in oxygen and nutrients and healing cells to the area that really start to kick this recovery response up a notch. And then because of the new blood vessels, Step number 5 is we can actually start to get some new growth, collagen remodeling into the area. The body rebuilds stronger, more organized tissue to replace the damaged tissue that was there before. So now we have number 6, stronger tissue. The tissue becomes more resilient, more stable, more functional, and then pain decreases. Because remember, pain is just a signal that there's a problem. It's like the alarm going off. It's like your body trying to tell you, hey, there's something not right here. And now when that tissue becomes more resilient and stable and functional, that pain begins to go away long term because you're actually getting real healing into the area. So we have better movement and just a better life, right? Move better, feel better, live better. Shockwave is that spark that initiates your body's healing process. Now, your body still does all the healing. It's just that we're sending that mechanical stimulus in there to re-kick off this cascade that needs to happen. And so we're not masking the pain. This isn't like getting a cortisone shot into the area or taking a pain pill. This is re-triggering the healing process that's happening inside of your body. It's like the domino effect, right? One tiny stimulus creates a much larger healing response over time. And that one stimulus was the focused shockwave that we were delivering to the joint, that right mechanical energy delivered in the right area that just kicked off this domino, cell signaling, growth factors begin to moving into the area. Those growth factors promoting new blood flow, new oxygen and nutrients and healing that can finally start to happen so that collagen and tissues get stronger and healthier. And then that tissue becomes resilient and stable and you're able to function and do the things that you want to do every day. This is how your body heals. Shockwave just helps start that chain reaction. So scientists call this, as I mentioned before, mechanotransduction. It simply means mechanical energy is converted to biological energy. So the mechanical energy is that shockwave that we deliver in the precise area. Then the cell response, because it senses that mechanical energy coming in, and then it responds to that force. And that response creates this biological signaling. The body activates its natural healing responses. So it's not just comfort. We're not just, helping you feel better for a little while. We're really helping that joint to heal. Your body has the power to heal built inside of it. Shockwave just helps unlock it. So shockwave does a lot more than you think. Focused Shockwave Therapy targets the source of the problem, activates your body's natural healing, reduces inflammation, improves circulation, breaks down scar tissue. It helps dissolve adhesions, promotes healthy tissue remodeling, stimulates cellular repair, activates your body's natural healing process like stem cells, building that collagen and those other tissues, and just restoring function, helping you feel better and helping you function better. Instead of just relieving symptoms, we're actually promoting the healing process. And there's real science behind this. Our patients are getting results like crazy. Check out some of our testimonials on our YouTube channel. Patients are seeing amazing results with shockwave therapy. They're getting fast relief because you're going to get relief after the first couple visits, but they're getting lasting, real relief, which is what's really important. So why choose shockwave therapy? Well, hopefully you've already, from what I said, you see the reason why we should choose that. But shockwave therapy is a powerful, non-invasive solution, meaning there's literally almost zero side effects to this. Absolutely almost zero contraindications for use, other than we're not going to do it over like a pregnant belly, of course, the baby in there, we wouldn't do that. Or we're not going to do it over cancer or over something where we shouldn't. But there's almost zero side effects to this, and it's backed by science, trusted by thousands. It's in thousands of clinics across the United States, ours being some of those clinics. We can target that root cause, give you a safe therapy, and then we know that it's backed by science, it's clinically proven. You're going to get the fast results that you want, but more importantly, you're going to get the long-lasting relief, right? This is the cutting-edge technology that offices are using now to enhance natural healing. And where does shockwave make a huge difference? How do you know if this is you or not? Well, tendonitis is a big one. I had a shoulder tendonitis. I started using shockwave on it. Absolutely knocked it out quick. It targets those conditions and then it helps us to be able to heal from them. Knee pain, we use it in knee patients all the time. We also have knee decompression we couple with shockwave to help get regrowth, help treat arthritis, tendonitis, runner's knee, all of those things. The plantar fasciitis is actually one thing that this unit is FDA cleared for. It is some of the best treatment you could possibly do is for plantar fasciitis, for heel pain, for arch pain. We use it on the bottom of the feet for neuropathy all the time, and it helps to get healing happening in through the feet, blood flow, regrowth of new blood vessels. Absolutely amazing for the foot. Like I said, shoulder pain, rotator cuff, bursitis, impingement helps with all of those things. Low back pain, upper back pain, neck pain, we use it a lot for that too, for muscle strains, disc issues. Look, I paid $10,000 for disc, stem cell injections in my lower back. Within the 5th to 6th visit, some studies show we're getting actual stem cell production in through areas. So we're using it around the spine to help with those discs, to help regrow some of those tissues. For shin splints, for sports injuries, just help you recover faster and get back out there and get going again. So we target the pain, but we trigger the healing. Shockwave is absolutely amazing for that. Why doesn't everyone heal naturally? Well, here's the process that happens. We get injured, then inflammation starts to set in, and then sometimes we get stuck, right? Because not only are we injured, now we're re-injuring this over and over and over because we don't really let our body heal. The blood flow is not getting where it needs to be, so we got poor circulation to the area. You can't heal if you can't get blood flow. That's one of the reasons with neuropathy we have risk of losing toes, right? Toe amputations with neuropathy because we lose blood flow. You can't heal if you don't get blood flow to the area, period. And then we see that a lot in diabetes, just even overuse injuries, scar tissue that's been in there, even aging. We just have less blood flow and we heal. It takes longer to heal when we age, right? So that healing stalls and chronic pain sits in. But when we get that shockwave in there and reestablish this, kicking off this healing, getting blood flow, getting stem cell production, all those things, that healing starts to begin, and then we start to get that healthy recovery that we want. So shockwave helps restart that healing process that has maybe slowed in your body or even completely stalled and turned chronic. So what do you do? What do we do when a patient comes in? This is the shockwave process in our office. It's simple, it's easy, it's comfortable. You're going to come in, you'll sit down with us, we'll do a consultation and exam. We identify your source of pain. We create a plan just for you. We do targeted treatment even that day when you first come in for that exam. High energy sound waves that are delivered right to the area where we need it. It stimulates healing. We get increases of blood flow, like I said, up to 39% on the first visit. Breaks down scar tissue that you may have in the area, activates that healing response. It's comfortable, it's quick, 15 minutes. You're maybe in the office for 20, 30 minutes, no downtime. You don't have to recover from a surgery or anything because surgeries can take weeks to recover from. Shockwave, 0 downtime. You're feeling great right after the therapy. You get your life back, you feel better, you move better. Again, we don't mask the pain, we restart the healing process. And then what does a treatment plan look like? Because it's, you're usually getting benefit out of just one visit, but it's really that series of visits that makes such a bigger difference and starts to help your body really heal long term. So after the exam and evaluation, where we've identified the source of your pain, we've identified the problem and where you need the treatment, then we're going to do shockwave treatments that maybe just take 10 minutes, but they stimulate healing every time we do them. We're going to be consistent 1 to 2 times per week for just, 4 to 6 weeks. That's all it takes in most cases. You're feeling better, your body's stronger, you're free from pain. Most patients experience significant improvements over a series of visits like this. Every plan is customized. That's why we sit down, we do an exam, a consultation, and evaluation with you. Any necessary x-rays, we take those in our office. Everybody's different, so we want to make sure you get the exact care that you need. Is it right for you? Well, we're not going to do shockwave over areas that are contraindicated. If you have fracture or broken bones, we don't do that. If you have active infection or fever, we don't use shockwave. If you have cancer in the area, we don't use shockwave. Pregnancy, we don't do it directly over the abdomen. We could do it in other areas, joints like the knees or shoulders, but not over the stomach, of course. Pacemakers, we just don't do it right over the pacemaker, just like in pregnancy. We're not going to do it on top of the pacemaker, but we can use it in other joints and areas. In certain medical contradictions, that's why we do the full exam. We're going to make sure that you're a candidate for this. If you have chronic tendon pain, plantar fasciitis, arthritis, rotator cuff injuries, old sports injuries, tennis elbow, Achilles tendon pain, or plantar fasciitis, or neuropathy, knee pain, those are the things Shockwave is amazing for. We can get targeted care, safe, non-invasive, clinically proven, and help you get back to doing what you love and get you pain free. Now, in this workshop, at the time I'm releasing this is our big Christmas in July patient appreciation event, and we're giving you huge discounts in our office for all of our established patients. So you can get 12 credits for just $5.99, 24 credits for just $10.99, 36 credits for $14.99, and you can use these for anything in our office. You can see the adjustment is just 1 credit, the decompression is 1 credit. Now Shockwave, because it's a lot more expensive therapy, it's 2 credits, but still you're getting hundreds of dollars worth of savings for this therapy, and you're getting that pricing only for this week, and this week only for Christmas in July. And so I want to make sure that if you find us, come into the office, call us, or click the button that was in the email where you got this video, and let's get you set up with Shockwave therapy. Let's get your body healing the way it was designed to heal in the first place, and I think you're going to love it. All right? Thanks for taking the time to be in on this workshop. I'm Dr. Tabor Smith, and I'll see you soon.